I'm David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including Florida pain clinics, physical therapy practices, and chiropractic doctors. The topic today is degenerative disc disease. What are the injection options that can work well? Well, degenerative disc disease affects millions of individuals throughout America, and here's a little bit about it. So these are called the intervertebral discs, and if they get degenerated, they're called degenerative discs. But at every level, they exist, and they consist of 80% water in a normal person. As we age, that 80% can start to drop. 70%, 60%, 50%, and as it drops, the disc can start to bulge because it starts to lose height, and it still has the same amount of stress going on it. In fact, if you're gaining weight as you age, it's got more weight on it. So it can start to bulge out, and that's called a bulging disc. How common is degenerative disc disease? Well, it's very common, but most people don't even know that they have it. So 40% of individuals over the age of 40 have degenerative disc disease on MRI and have no symptoms whatsoever. So just because it's there doesn't mean it's going to hurt. Well, what if it does hurt? Well, that pain can bother you every day, all day, and it can make it difficult to work, concentrate, play with your kids. It can be very depressing. So what are the options available for it? Well, additional non-operative treatments include physical therapy, chiropractic treatment, pain medication. Spinal decompression therapy is a great option that's offered by a lot of chiropractic clinics throughout the state. There are three main injection options that are available. So number one is injections actually right into the disc itself. So a pain doctor can actually minimally invasively with an x-ray machine put a needle into the disc that is the problem and inject steroid medication. That's called cortisone, and it can provide months of pain relief, which is great, right? It's not going to fix the problem, but it can be a great band-aid for months. The additional type of injection into the disc that can be done is stem cell injections, and that's called regenerative medicine, and that is being studied right now at multiple sites throughout the country. It is not available in the mainstream yet into the disc, okay? So I don't want you to get too excited, but there are some studies going forward that are showing some promise for stem cell injections into the disc. And the second type of injection that can be done is an epidural steroid injection. And that involves an injection in this area, not into the disc, but behind it, around nerve roots that are being inflamed. So the question is, why would you do that? Why would you do an injection that's not into the disc where the problem is? And it's very simple. If you have a tear in the back part of the disc, it can spark up inflammation and lead to pain. Pain in the back, maybe pain that goes down one or both legs, because it can irritate the nerve root. I mean, the nerve root's just an innocent bystander, right? It's just trying to get out of the spine, but you have a degenerative disc that's got a tear in it, and it's inflamed. It can inflame that innocent nerve root. So it's guilt by association. So the epidural injection can give months of pain relief to that inflamed area, and then it can be repeated. The third type of injection that works well for degenerative disc disease is a facet injection, F-A-C-E-T. So these are the facet joints up and down your spine. Why would you do that? If the problem's in the disc, why would you do an injection into the facet? Here's why. If you have a disc problem, it can cause abnormal motion at that level. So normally you have awesome range of motion at each level, but if this is degenerative, it can be abnormal and push stresses back to these, the facet joints. That can cause degeneration and pain there. So an injection either in or around those facet joints can give pain relief for months as well, and it can be a great addition to the pain management regimen to keep your degenerative disc disease pain, down. So you have three options that pain management doctors can perform, and the combination together with the non-operative other treatments, you can get over 90% pain relief, usually, 70 to 90%. Well over 90% can avoid surgery with these types of treatments. So FloridaPainNetwork.com is the website. If you need a pain doctor, just click on I need a pain doctor. Put your zip code in, the closest ones to you show up. Information, their phone number, the types of doctors, those types of things. Same thing with a chiropractor. Just click on I need a chiropractor and put in your zip code. The closest ones to you will show up first in the listings. Thanks for watching. I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.